Welcome to my channel. Try to boost your mind and answer first just by looking at the picture, and then compare your answer with my answer. Systemic sclerosis, scleroderma, can significantly alter facial features. Here's a brief explanation. Tightening of skin. The skin becomes thickened and tight, leading to a smooth, mask-like appearance. Microstomia. This tightening often results in a smaller mouth opening, microstomia, making it difficult to eat or speak. Pinch faces. The nose can become thin and pinched, and the lips can become thin as well. Rheumatoid arthritis, RA, can cause characteristic hand deformities. Swan neck. This deformity involves hyperextension of the proximal interphalangeal, PIP, joint and flexion of the distal interphalangeal, DIP joint.
Boutonnière.
Conversely, a boutonniere deformity presents as flexion of the PIP joint and hyperextension of the DIP joint. Z-thumb. This deformity features flexion at the metacarpophalangeal, MCP, joint and hyperextension of the interphalangeal, IP joint of the thumb, creating a Z shape. When a high-resolution CT scan of the chest reveals honeycombing, it signifies a specific pattern of lung damage. Here's a simplified explanation. Clustered cystic spaces. Honeycombing appears as clusters of small, air-filled cysts with thick walls, resembling a honeycomb, indication of fibrosis. This pattern is strongly associated with pulmonary fibrosis, a condition where lung tissue becomes scarred. Significance. It's a key finding in certain interstitial lung diseases, particularly usual interstitial pneumonia, UIP, and can indicate advanced lung damage. A CT pulmonary angiogram, CTPA, revealing a large saddle embolus indicates a critical medical emergency. Here's a breakdown. Saddle embolus location. It describes a large blood clot lodged at the bifurcation of the main pulmonary artery, where it branches into the right and left pulmonary arteries. Severe obstruction. This location causes significant obstruction of blood flow to both lungs, severely impairing oxygenation. Life-threatening. A large saddle embolus can lead to acute right heart strain, hemodynamic instability, and potentially sudden death, requiring immediate medical intervention. Hypertrophic pulmonary osteoarthropathy, HPOA, is a syndrome characterized by bone and joint abnormalities. Here's a concise explanation. Bone and joint pain. It typically involves painful swelling of the joints, especially in the wrists and ankles, and thickening of the long bones. Clubbing. HPOA is often associated with digital clubbing, which is the abnormal widening and rounding of the fingertips and toes. Underlying disease. It is often a paraneoplastic syndrome, meaning it occurs as a result of an underlying disease, most commonly lung cancer, but also other pulmonary diseases. Thank you for watching my video. To learn more about TOACS, please stay tuned, and don't forget to like and subscribe.